everyone. I'm Jim Longworth, and welcome to a very special edition of Triad Today as we spend the next half hour talking about honoring and saluting Mountain Valley Hospice and Palliative Care and all the great work they do and the great team there. We're going to get into all sorts of things with you over the next half hour, but where we want to start is just sort of a general feeling of what the mission is and the locations and what they do. We do that with a special friend of ours who's been on the show before. Tracy Dobson is President and CEO of Mountain Valley Hospice and Palliative Care. Welcome back to the show.
Thank you, Jim. Nice to be here.
What's the basic mission, just in a nutshell, what's the basic mission of Mountain Valley?
Our mission is to serve every patient, every family, every time.
And you guys are everywhere, it seems. Now, you don't have to list all the locations, but you cover a really big area, don't you?
We do. We cover 2 states, North Carolina and Virginia, and that's 18 counties.
Didn't you just also add a couple of offices or something in this past year or so? Tell me about that.
We did. We added King, North Carolina, and Winston-Salem, North Carolina. They're our serious illness clinics.
The serious illness clinic. And, I'm glad you mentioned that, because with the Winston-Salem office to really deal with that and specialize in that sort of leads me to something that we were talking about before we started taping, which is this program, especially when we're talking about advanced cardiac care, that a very fine lady that works for you, Christy Sharpa, has been on the show before talking about this very program. And I thought if it's okay with you, we just take a moment to look at some excerpts from a conversation I had with her earlier. So
Absolutely.
Let's do that. With me right now, our good friend Christy Sharpa, who's Senior Director of Practice Management for Mountain Valley Hospice and Palliative Care. Welcome back.
Thank you.
You sent me an email saying that we wanted to talk a little bit about something called advanced cardiac care. Now, what is that exactly?
Well, for our hospice patients who join our program, those folks have a special set of circumstances and symptoms. They can often be feeling okay and get real uncomfortable really quickly. So we want to be able to address those symptoms really quickly. So we've joined with American Heart Association and National Partnership for Hospice Innovation to create a program where we can have certain medications and responses set up in the home, so we can quickly address symptoms like chest pain, shortness of breath, and keep those folks out of the hospital, home, comfortable, and resolve that discomfort quickly.
Now, why is there such a focus from your standpoint on heart failure?
Well, it's just so pervasive. It's so common. You'll be hard-pressed to meet someone who doesn't know someone who has it or has it themselves. So heart disease is the #1 killer in our country. And on the journey of this illness, you have so many symptoms, and you have to change your lifestyle and sometimes your diet, and it affects your personhood. And so on the hospice portion of the journey, we're just really wanting to help people live as well as they can, with their symptoms managed, to feel well, to have some energy, to be able to enjoy life, and keep them out of the hospital is the key.
Yeah. Now, who's qualified to actually get into your program, though? How do you decide that?
So anyone who's appropriate for hospice. So these are folks that have more end-stage heart failure, perhaps a prognosis of 6 months or less, although that's not firmly delineated. But we figure that out in conjunction with the patient's cardiologist, with their primary care doctor. We look at their medical record, at their illness journey, and figure out if they are hospice appropriate. And then of that population, we look at the folks who have this advanced cardiac disease and put together these special medication packets and just some extra special nursing support.
Yeah, now if I have an elderly parent who maybe is a candidate for hospice but also has heart problems, would she or he be able to keep their cardiologist they've been seeing?
Yes, absolutely. We work hand in hand with the cardiologist. Oftentimes our patients will become really comfortable with us, and it's tiring to run back and forth to the cardiologist and all these different appointments. But so we'll just see the patient, but we can be the eyes and ears for the cardiologist and reach out to them and collaborate as to whether or not a certain medication maybe should be tweaked or changed. So it is a partnership.
I think that's great that everybody's teaming up. Okay, now I promise I want to talk about this downloadable patient guide. I think we even have a graphic on this. What does this downloadable patient guide tell us?
So it's information for the patient and the caregiver, everything from soup to nuts about what is heart failure, what is it doing in your body, what are the symptoms, what are the medications used to treat, what are some health interventions you can do from a dietary standpoint or weighing yourself daily to help ward off uncomfortable symptoms. It's kind of a user's guide, if you will, and we have it in English and in Spanish.
And easy to download.
Easy to download and easy to understand.
Even for a non-tech guy like me, I can download it.
Absolutely.
All right, again, and our thanks to Christy Sharpa for those comments. Tracy, before we wrap up this particular segment and get to some other topics, I think it's important to remind people that Mountain Valley Hospice and Palliative Care is a nonprofit agency. Why is that important?
It's really important because we take care of those who can't afford to take care of themselves. They have no insurance, no financial means, and so those funds also help them.
Yeah,
offset their.
and you just don't turn anybody away. And I'm not going to mention any names or go into the things like that, but there are for-profit hospice agencies around the country. And sometimes they have a pretty strict screening process and that kind of thing. And I think it's so important that you're there for everybody. The doors are open. And I just appreciate all you're doing for folks.
Thank you. We appreciate serving.
We're going to bring you back a couple of times during this special program. In just a minute, we're going to take a quick break and get into some of the topics, and then you and I'll be back later. So before we do that, I also want to put up on screen, just so everybody can remember, mountainvalleyhospice.org. It's mtmvalleyhospice.org, or you can make an appointment or call 888-789-2922. mtmvalleyhospice.org is the general website. Tracy and some of her great staff and everybody will be back in just a minute with more on Mountain Valley Hospice and Palliative Care. Back now on this special tribute, understanding more about Mountain Valley Hospice and Palliative Care, their great team and all the great things they do for so many folks. And in this segment, we have two lovely ladies who are going to talk about a couple of areas, volunteerism, fundraising, and growth and access. We're going to do that on my immediate right with Sarah Tavery, Senior Director of Philanthropy and Volunteers, and socially distanced in the center there for us, our good friend Stephanie Tilley, Senior Director for Growth and Access at Mountain Valley Hospice and Palliative Care. Good to see you. Thanks for being here.
Thank you.
Stephanie, let me start with you, because when we see your title come up on screen, it's going to say Growth and Access. What do you mean by that, growth and access?
The focus of growth and access is the focus of access to care. So our team wants to ensure that every hospice eligible patient can gain access to care. Many are surprised that statistically that only 50% of patients who meet the eligibility for Medicare actually utilize their Medicare benefit.
So it's out there and they just don't know it.
That's right.
And as Tracy and I talked about before on the show, you don't turn people away either. But one thing you were talking about with eligibility and access, I guess I'm wondering, how does a patient or family member know that maybe it's appropriate to start the conversation about hospice? How do you know?
Most of the time families will reach out to us, or maybe their physician or someone else in the community will reach out to us, and one of our team members will meet with them and discuss their goals of care and where they are in their illness journey. And then at that point, along with their physician, we'll determine which program meets their needs. Sarah,
let's come back to this thing that, again, I mentioned that Tracy and I talked about the nonprofit status. So how important is it for you to do fundraising events? I know throughout the year we talk about various ones that you have. How important are they?
Well, because Mountain Valley is a community-based nonprofit hospice, it's really important that we have the financial support of members of our community, the communities in which we serve, in order to carry out our mission and to care for our patients and families.
What kind of events are we talking about? Give me an example of one or two that typically we do. I mean, there's some new ones, but there's some that happen every year. What are some examples of fundraising events?
Sure. So our most popular one, I would say, is the Big Hospice Raffle.
Okay.
We have that every year.
Right.
We just had it in May. It was a huge success. We were really fortunate in that almost 50 local businesses contributed, donated raffle prizes for the event, and we sold over 2,000 tickets.
Great support from the community, which leads me to ask exactly how the proceeds are used from your various events. What, people might wonder, well, what exactly do you use them for? What element of hospice care do you use them for?
Okay, so proceeds from these events and any type of fundraising we do goes to support our services, our patient services, and also our special community programs. In particular, our most important need is for charitable care, because that's what enables us to not have to turn anyone away
Right.
due to inability to pay. So through the charitable care program, we pay for hospice services for patients who are uninsured or underinsured and lack the financial resources to pay for their hospice care.
Now, you work with volunteers a lot, right?
Yes.
How important are they?
Well, I've said this before, and a lot of people say this, and I'm just going to say it again because it's so important. Volunteers really are truly the heart of hospice. We are so fortunate to have a great group of volunteers. They are vital to helping us carry out our mission and to provide compassionate care to our patients.
If I want to volunteer, what kind of duties can I do?
We have a wide range of duties, and it really depends on what someone's interested in doing and how involved they want to be, how much time they have. One of our more urgent needs is for patient care volunteers, and these are volunteers who go into patients' homes or the hospice homes, and they sit by the patient's bedside. But we also have a lot of other opportunities. Volunteers can make tuck-in calls to patients and families toward the end of the week to
Right.
make sure they have what they need for the weekend. They can bake birthday cakes, bake cookies, help on the grounds. We also need volunteers for our resale shops, and also we always need event volunteers.
Absolutely. I want to put something up on screen here so people can find out more information, especially if you'd like to donate something or, make a donation or interested in becoming a volunteer and find out what the qualifications are. mtmvalleyhospice.org is a general website, or you can call 888-789-2922. And to Sarah and Stephanie, I appreciate all that you guys are doing. Thanks for everything.
Thank you.
We'll be right back after this. Back now on our special edition of Triad Today as we salute and understand more about Mountain Valley Hospice and Palliative Care and their wonderful team. And in this particular segment, we want to talk about in-home and hospice home, the different ways that people receive hospice care. And we do that with a very special Jenna Campbell. She's Chief Clinical Operations Officer for Mountain Valley Hospice and Palliative Care. Welcome to the show.
Thank you. Thank you for having me.
As I mentioned sort of in the intro, most people, I don't know the percentage, most people when they're receiving hospice care, they like to do it at home and have your team come in. Other people, there are, I think, 2 hospice homes that they can go to when appropriate. I want to get into both of those things, so let's tackle the first one with at-home care. What kind of services can you and do you provide to hospice patients in their own home?
Patients in their home are entitled to receive nursing care available 24/7. We don't stay in the home 24/7, but we are available 24/7 to support needs. We have CNAs who can help with bathing and dressing patients. We have spiritual support coordinators. Those are our chaplains. And then we have social workers who really help manage the resources. So they can manage with Meals on Wheels or different resources in the community to help patients.
And I guess, too, that I think we've talked about in various emails and correspondences before, this whole respite care thing, too. If I'm at home and let's say my loved one is under hospice care, it's pretty stressful to be looking
Right.
after somebody 24/7, even though you guys come in and help out immensely. But I guess there are volunteers and others that can sort of give me a rest, too, right?
Correct. So we do have volunteers support. They can alleviate the caregiver, like if the caregiver needs to run to an appointment, they can stay with the patient in the home. But then we also offer our respite within the inpatient facilities.
All right, now, Jenna, let's get to the main question I want to ask you, which is, at what point would it be appropriate for the family to say, okay, we've been receiving care in home. At what point is it appropriate to have the discussion with you about moving to one of your hospice homes?
It's a good question. We have 2 main levels of care that we do at our hospice home. We have our general inpatient care, which is symptom management. So it's like our hospital. So uncontrolled pain, uncontrolled nausea, whatever the symptom may be. So there's no wrong time to go. It's when we can't manage your symptoms at home. We've exhausted all efforts at home. So we need to take it a step up and have the provider more involved at the bedside. The other option is respite, which is caregiver breakdown. So if you are caring for someone 24/7, you get tired, you need a break, or you've got a wedding or a graduation to go to out of town, you would
Right.
plan to come to our hospice homes, and those are 5-day stays.
5 days, temporary stays for that. That's just, yeah, it's great, the kind of service that you offer. Now, with the two homes are, I think they're what, in Mount Airy area and also Yadkinville
And
one?
Dobson is our Woltz Hospice Home, and then our SECU Yadkin Care Center is in Yadkinville.
I've heard y'all talk about before, Tracy and some other folks, about the hospice homes are pretty neat because they feel like home, right? I mean,
Yeah.
you went to great lengths to make them accommodating, didn't you?
Yeah, so it is a very home-like atmosphere. So the rooms are not like hospital rooms. They're more set up like a bedroom. I have a couch for family members to stay on. We have kitchens, sunrooms, playrooms for children. So it is very accommodating for the families as well.
You talked about earlier the team of folks that come in and help you, whether you're getting care at home or at a hospice home. So let's, in the minute or so we have left, let's talk about that team. How does the patient benefit, and the family, from having that team approach?
The team approach is holistic, is unlike any other team approach that you get in healthcare. That's what makes hospice so special. They work together, they collaborate. Many of our nurses are certified in hospice and palliative care, as well as our providers. So you get specialized medical care, but you also get your holistic care from your chaplains and your social workers.
All right, that's great. Up on screen, mtmvalleyhospice.org if you want to check out the website, or you can call 888-789-2922. And Jenna, if it's okay, we're going to hold you over for the next segment and also talk with a very distinguished physician, aren't we?
Yeah.
All right, we'll be right back after this. Back now in this special salute to Mountain Valley Hospice and Palliative Care. We have three very special guests with us, too, that you've seen already in the program before. Coming back with us now, of course, Tracy Dobson, President and CEO of Mountain Valley Hospice and Palliative Care. Centered between her and Jenna Campbell, who was here earlier, Jenna's Chief Clinical Operations Officer. Centered between them is a special guest, the first-time visitor to Triad Today, Dr. Glenn Goloszewski. We call him Dr. G. He's the Chief Medical Director for Mountain Valley Hospice. Good to see you. Dr. G, let me start with you. Who or what led you into the field of medicine? Was it a teacher, a father, a mother, some role model, or I mean, what was it?
I am old enough that Marcus Welby was my role model growing up.
I remember that. I remember that. What a great show. Great.
It really was, and I have always wanted to help people. I have always wanted to be a doctor. I grew up in a very poor environment where that wasn't really a reality, so I worked for a long time, and I worked my way through college and medical school.
I just think that's a great story. Now, since people will see on your title on screen, Chief Medical Director, let's understand what that is. Just briefly, what does a Chief Medical Director do in a hospice setting?
So what my role as Chief Medical Officer would be in Mountain Valley would be to ensure that all of our staff have the expertise and the support to ensure that all of our patients get the highest quality, state-of-the-art, evidence-based care that they need at the end of life.
You know, over the years, and I've known folks in Mountain Valley for many years now, and one of the common questions I get from folks that when they know I'm going to interview somebody from Mountain Valley Hospice, they'll say, hey, Jim, I ask them, does the family need a referral from their physician to come and make an appointment with Tracy and her team? Do you need a referral?
You need a referral, but not necessarily from a doctor. So certainly doctors, nurse practitioners, physician's assistants can refer to hospice and do all the time, but family members can refer, therapists can refer, and the patient can refer themselves as well.
You know, now folks at home who are watching this and seeing Dr. G for the first time see he has a very nice beard, and he traditionally has a nice beard. But there was a point, Jenna, where he shaved it all off, I understand. Yeah. Quickly tell me what that was about.
So we had the opportunity to serve a pediatric patient who had a respiratory disease that required a N95. We're all familiar with those throughout COVID,
right.
But Dr. G with a beard, you can't wear an N95. And one of his great loves is pediatrics, and he, without asking, just jumped right in and shaved his beard so that he could be at the bedside to help care for that patient.
Isn't that great? Shaved off a lifelong beard so that he could care for the child. Tracy, what does that say about Dr. G and his importance to the team?
Oh, it's a servant heart, passion, love, care, especially for others.
Glenn, let me flip this around on you because I know we don't want to embarrass you, but let me flip it around on you. Obviously, the staff, the patients love you. What's your assessment of working with the hospice team at Mountain Valley Hospice and Palliative Care? What do they mean to you? What do they mean to the patients and the families?
Oh my goodness, I don't know if I can express that on camera or not. They mean the world to me, and the love goes both ways, and we really do live up to our mission. We treat all of our patients like we would treat our mothers, and that's what I require as standard of care in our hospice, and our staff is happy to live up to that. So,
do I get to, if I'm a patient or a family member, and we didn't rehearse this or anything, I'm just curious, how often, or do I get to see you? I mean, there's a great team, and Jenna's referred to, and other folks in the Tracy said, the team, and you have chaplains, and you have nurses, and you have all that. Would I get to see you occasionally?
Yeah, part of your hospice care team is providers, and those providers are physicians and nurse practitioners that we have in Mountain Valley. And when you enroll in hospice, you get to choose your attending of record. So you can keep your regular family doctor if you want to, or we have our own doctors that can provide care. And of course, they are specialized in end-of-life care, and they can come to your house. So two big advantages for the patient and family.
And let's say I'm receiving hospice care at home, and let's say it's end-of-life care, and I've been through this with parents and others. The job, I guess, is very important because you're not doing surgery. You're not doing a lot of things like this. How important is it to keep folks comfortable?
Ooh, you hit the nail on the head right there. That's the ticket in hospice, is keeping people comfortable. And that's what folks want when they're dealing with end-stage illnesses and end of life, is they want to be kept comfortable. And not just the obvious things of, I don't want to die in pain, I don't want to be short of breath. But then we look into, what does comfort mean to that person?
Absolutely. Quality of life.
Exactly.
Dad was both mom and dad under hospice care, and I remember Dad, toward the end, I would sort of lift him up on the bed and we'd watch some old Western movies together, but he was comfortable because of that commitment there. I can't tell you how much your service means to so many folks, and Tracy's alluded to it, so has Jenna, and I appreciate what all three of you do. And one thing I want to put up on the screen before we forget, mtmvalleyhospice.org is the website. You can also call for an appointment or more information, 888-789-2922. And when we come back, I'll be with Tracy for a few final comments. We'll be right back. Back now on this special salute to Mountain Valley Hospice and Palliative Care. As we wrap things up, we have a couple minutes left, and so I wanted to bring Tracy Dobson back, who, as you remember from earlier, President and CEO of Mountain Valley Hospice and Palliative Care, just for some personal thoughts and observations. Tracy, you're a person I know, because we've talked about this before and at lunch and everything, that a great family relationship, deep faith. Tell me about how important it is in the relationship with you trying to, your hospice family, your team, your family that I refer to, caring for other people's family. Talk about that commitment, that personal commitment that you have.
We are servant leaders, and so we work as a team. We're very collective. We communicate. We all have different thoughts and ideas, and they come together to a beautiful thing. And we're able to serve our patients and their families in our communities that we work in. And it's just amazing how great, when you all are collective, what you can do, and being servant leaders. And, and you're here to serve others.
Yeah, and you sort of got that as a little girl, didn't you? I mean, they have a background of faith and family to how important service is, right?
I did. My mother was a teacher growing up. She was a special needs teacher. She's amazing. I learned great lessons growing up about how to be a good neighbor, be a good friend, be a good daughter, be a good church member, and really help others as you want to be helped.
Boy, and that really comes into play in the back of my mind. I'm thinking there's so many settings where people go and sometimes they feel lost and feel like they're just a number. And here you offer some very specialized care for special families and patients, and it's so important. I guess before we wrap up, just a couple seconds left, what's gratifying to you about your job?
I was just having this conversation this morning. It's the passion that we have to do what we do. It's not about money. It's about how it makes you feel. And being a servant leader, it just fills your whole heart, and you're able to do so much more because it's a love.
Well, I can see it in your face and in all the great deeds that you do and the various events that we talked about earlier in the program to help sustain hospice, and I just appreciate all you do.
Thank you.
We have just a couple seconds left. I want to put up on screen one more time. The website is mtnvalleyhospice.org, mtnvalleyhospice.org for more information, or if you want to call for an appointment, you can also call 888-789-2922. For Tracy, for all of her team, very special folks, and everybody here at Triad Today, I'm Jim Longworth. We'll see you next time.
My mother passed away on a Monday night. My dad and I were with her. What would have been a dreadful experience at home was a blessing at the Woltz Hospice home in Dobson. Mama was safe and comfortable. So were we. We were even able to bring our dog Gracie for a visit. From their in-home care to their hospice homes to helping us after she was gone. The people at Mountain Valley Hospice made us better people and became family.